Iran has launched devastating strikes against energy facilities in Saudi Arabia and Qatar, marking a dangerous escalation in the widening Middle Eastern conflict. The attacks targeted critical oil and gas infrastructure across both Gulf nations, sending shockwaves through global energy markets. These Iranian strikes came in direct retaliation after Israel attacked Iran's South Pars gas field and naval assets in northern waters. Saudi officials declared that trust between regional powers has completely collapsed, signaling a potential point of no return in diplomatic relations. The coordinated assault on Gulf energy sites represents Iran's most aggressive response yet, demonstrating Tehran's willingness to target the economic lifelines of its adversaries. Oil prices are expected to surge as international markets react to the supply disruption fears. This escalation threatens to draw additional Gulf states deeper into the conflict, potentially transforming a regional dispute into a broader war that could reshape Middle Eastern geopolitics for decades. Health authorities across England are on high alert as a rapidly spreading meningitis outbreak in Kent has infected 20 people since the weekend, prompting urgent warnings to medical professionals nationwide. Doctors and healthcare workers have been instructed to immediately watch for symptoms of the potentially deadly bacterial infection as thousands of residents receive emergency vaccinations. The outbreak's unusual speed and concentration in one small Kent area has baffled medical experts, who say this pattern defies normal meningitis transmission models. Health officials are working around the clock to identify what factors may have accelerated the spread so dramatically in such a confined geographic region. Meningitis can cause fatal brain and spinal cord inflammation within hours if left untreated, making early detection absolutely critical for patient survival. The government has mobilized additional medical resources and vaccine supplies to contain the outbreak before it spreads beyond Kent's borders. Authorities expect to announce expanded vaccination programs and enhanced surveillance measures as they race to prevent a nationwide health emergency. Shocking allegations have emerged against iconic labor leader Cesar Chavez, with a comprehensive New York Times investigation revealing claims that he sexually abused women and girls, including allegedly raping his longtime organizing partner Dolores Huerta. The explosive report threatens to fundamentally reshape the legacy of the revered civil rights figure who championed farmworker rights for decades. Multiple sources detailed disturbing patterns of abuse spanning years within the United Farm Workers organization that Chavez co-founded with Huerta. The allegations include systematic exploitation of vulnerable women and girls who looked up to Chavez as a hero and mentor in the labor movement. These revelations have sent shockwaves through civil rights organizations and labor unions that have long celebrated Chavez as an untouchable icon of social justice. Schools, streets, and monuments bearing his name across the country now face intense scrutiny as communities grapple with separating his public achievements from these deeply troubling personal allegations. The labor movement must now confront how these revelations will impact ongoing organizing efforts and worker advocacy campaigns. Medical investigators are scrambling to understand why a meningitis outbreak in Kent has spread with unprecedented speed, infecting 20 people in just days within one concentrated area. The rapid transmission defies typical meningitis patterns, leaving health experts searching for environmental or social factors that may have accelerated the bacterial infection spread. Epidemiologists are examining everything from local water supplies to community gatherings, trying to identify what made this outbreak so uniquely aggressive compared to historical cases. The concentrated geographic clustering suggests a common source or unusual transmission pathway that hasn't been seen in previous meningitis outbreaks across Britain. Health officials are conducting detailed interviews with infected patients and their families to map potential exposure points and transmission chains. The mystery has prompted emergency protocols typically reserved for bioterrorism threats, as authorities work to rule out any artificial acceleration of the disease. Scientists warn that understanding this outbreak's unique characteristics is crucial for preventing similar rapid spread scenarios that could overwhelm healthcare systems and threaten public health preparedness across the United Kingdom. 2 men have been charged with allegedly conducting extensive surveillance operations against London's Jewish community on behalf of Iranian intelligence services, highlighting growing international espionage threats targeting religious minorities. Counterterrorism policing revealed that the suspects had been systematically monitoring locations and individuals connected to Jewish organizations, synagogues, and community centers across the capital. The alleged surveillance operation represents part of Iran's broader intelligence campaign against Jewish communities in Western cities, raising serious concerns about foreign interference and domestic security. Investigators discovered detailed reconnaissance materials and evidence of coordinated tracking activities that could have facilitated future attacks or intimidation campaigns against British Jewish citizens. This case underscores Iran's increasingly aggressive intelligence operations in European capitals, particularly targeting Israeli-linked assets and Jewish community infrastructure. The charges come amid heightened tensions between Iran and Western nations, with intelligence agencies warning of escalating foreign espionage activities on British soil. Security officials expect this arrest to prompt enhanced protective measures around Jewish community facilities and increased monitoring of suspected Iranian intelligence operatives throughout the United Kingdom.